treatment to matched clients. And it went the other way. Clients sometimes expected less favorable treatment, or that they would be treated more harshly when the social worker was from the same race. And in fact, several of the social workers talked about encountering clients who asked them to have a different social worker who is not of their race, because they were afraid they would be treated more harshly. Yeah.
Can I share an experience? I'm by birth Korean. When I was a doctoral student in Madison, Wisconsin, we had speech and hearing clinic.
Mm-hmm.
Some Korean parents prefer not to have Korean therapists because they do not want the therapist who share the same race know their child has speech language issue. Even though speech language issue is not as severe as some other disorders, but that I experienced.
Yeah.
So when I had a client in Gainesville, Florida, who after that experience, we had a client, Korean American child who was about 3 years old, came to our speech and hearing clinic. Another therapist had him on her case. That therapist came to my office and asked, "Can you take him over? I don't feel I'm making progress with him." So my response was, "It's not our decision. It's parents' decision." So we went, talked to the mother, and explained the situation. She said she was okay. For me, as a Korean-speaking therapist, take him over. So that can go either way, and I can relay your points, your findings, to my personal experience.
Thank you. Also, so same ethnicity between social worker and client does not always mean same culture. There was a particularly interesting participant in our study that talked about this. She said that she was African American social worker, and she got a lot of cases that were African American clients. And they would use a lot of street vernacular and wording she didn't understand, because she was actually raised in Newport Beach. And she said, I had no idea what they're talking about. This was all interviews. So I found that very interesting. Okay, so as future health professionals, our task is to bridge the gap when we're working with folks that are from different cultures than our own. And in order to do that, I recommend situating your work in your profession's values. Each profession represented among you grad students here have a set of values, okay? And undergrads, I guarantee you the disciplines you're in have values that inform them. So for instance, in communication disorders, right on the website, as part of their mission statement, they talk about educating and providing practicum experiences that with individuals from culturally and linguistically diverse backgrounds. Public health has a statement through APHA, the American Public Health Association. Emotional and psychological states are culturally influenced, and there's an increased need for health and mental health professionals who speak the language of the client populations and are knowledgeable about the culture of the client populations. Both are very important, right? Language is certainly important and can be quite a hurdle. I think of a case I was working with that was a Laotian family, and I had to work with an interpreter in the community because there were no professionals available who spoke their language. And this is way back when I was a practitioner and I was in child welfare. So it was an investigation. And the interpreter kept telling me, this is kind of a stigma issue, kind of like what you were talking about, Hekyon. The interpreter kept telling me there's no such thing as physical abuse in our community. There's no such thing as sexual abuse in our community. She was wrong, by the way, unfortunately, in that particular case. But, you know, so, and the whole use of interpreters is a whole thing we could talk about in and of itself. I've had many interesting situations with clients along those lines. In social work, we've got a whole standard on cultural competence. One of our major core values is diversity and inclusion. One of the comments out of the standards is cultural competence requires self-awareness, which is an important point, cultural humility, and the commitment to understanding and enhancing culture is central to effective practice. So I'm going to talk about cultural competence for a minute. I've got some definitions in here, but I'm going to go straight to the one from social work because I get to pick on social work because that's my area. Here's from the standards I just mentioned about cross-cultural knowledge. Social workers shall possess and continue to develop specialized knowledge, emphasis mind, that is inclusive of history, traditions, values, family system, artistic expressions, immigration or refugee status, tribal groups, religion, spirituality, sexual orientation, gender identity, expression, social class, and I left some things out, by the way, and mental or physical abilities of various cultural groups. It's a lot, right? Are you going to be able to know this about every one of your patients or clients? All of this, be able to find all of this out? Be incredibly difficult. So what can be the guiding principle then? We're just not going to be able to know all of this. It will be great to get as much information as you can when you interview clients or patients or clients. But you know, there's a problem to me, this is just my take, by the way, with cultural competency defined as a knowledge base, a set of skills, because it can lead to the very thing we're trying to avoid, stereotyping. Here's a couple other people writing about this. Virtually any generalization about any cultural group is by definition a stereotype. Culture taught as specialized knowledge can become a description of specific client traits, ostensibly creating a stereotype in the very effort to avoid it. And we do this all the time because on site, when we meet someone, things click off in our heads. You know, we have assumptions, and we'll talk about this a little bit later. We're going to test your assumptions a little bit in a minute. So there's another concept, cultural humility, that seems to be more useful to me. This is also straight out of these are the standards I keep talking about, cultural competency standards, are from the National Association of Social Workers, and this is what I'm referring to, by the way, if anybody wants to take a look at them. So they define cultural humility as a lifelong commitment to self-evaluation. Remember that part, that's really important. To redressing the power imbalances to the patient-physician dynamic, and to developing mutually beneficial and non-paternalistic clinical and advocacy partnerships with communities on behalf of individuals. That's kind of a lot. So let's go to encapsulate it this way. It's a way of maintaining an interpersonal stance that is other oriented. Also, in the standards I'm referring to, they talk about being in a stance of learning, a learning mode, and how that important that is for social workers with patients or clients. The social worker as a learner. And I bet we could say that about folks that become professionals in public health and speech pathologists, etc. That folks from common disorders, that they would all agree with that, to become learners with our clients or our patients. The client is the expert on their experience. I always tell my students that, by the way. And they, in these standards, talk about cultural humility as both a value and a practice. Okay, so that the practice is informed by the value. It's value-based rather than a knowledge base. Okay. Ironically, it can actually help you develop more cultural knowledge and stronger skills because you're, I tell my students all the time, give away your power. You know, you don't, when you're working with clients, they're always going to see you as more powerful, but you don't need to hold on to that. Learn from them. And the stance I recommend is, I usually call it educate me, where you're saying to your clients, please educate me.